Hi there, welcome to the Gutzy Show with Coach Rachel. Tonight's topic is why gut health matters. Get your gut well, achieve optimal health. This show airs the first Thursday of every month, 7 p.m. Eastern Time, right here on the Florida Guts coaching page. So if you want to learn more about gut health, go to the playlist on this page and you can find out more. I've been doing these for a little over a year. So if you're here with me as a live, put that number 1 and put a hello in there. Hello and welcome everybody. I am so glad you're here with me. I love to see who's here with me. If you're here as a replay, thank you so much for taking the time to stop by and watch this and put a number 2 and say, hey, what's up there. So before we get going on tonight's topic of get your gut well and achieve optimal health, hey David, nice to see you. I'm going to introduce myself for those of you who don't know me. My name is Rachel. I'm CEO and founder of Florida Guts Coaching, and what I get to do is to help individuals conquer their abdominal bloat, slim their waistline so they can feel fabulous and confident in anything they have on, any outfit they have on, and in life. And I help them get their gut well in the process, because really, when your gut feels like crap, guess what you feel like? Crap. Yep. No, well, yes, there is a pun intended there. So before that, I do want to say a little disclaimer. Everything I share in my lives is for informational purposes only. And please collaborate with your primary care doctor, your medical provider, functional doctor, whoever that may be, for your care. In fact, all of my clients that come to me have already been to the doctors. Or if maybe they've had their discovery call and they haven't been to the doctors, I do tell them to collaborate with their doctors, because bloating can be a sign of a serious disease or illness going on, a process going on. So I want to make sure that's caught. And so the clients that come to me generally have been worked up by the doctor, they've taken the medications, they've done the tests, x-rays, CAT scans, colonoscopies, EGDs, nuclear medicine tests, you name it, and everything's normal. All right, that's all we have. Take some fiber, take some probiotics, and you'll be fine. Now, I am a registered nurse, a certified gut health coach. I have 30 years in nursing, 15 of those years in the digestive diseases arena, actually taking care of patients. Lots of respect for the doctors. However, they're not taught how to coach into a modified lifestyle. They may give you a little list. And when you work with me, one-on-one coaching, you will get a whole hour to yourself to talk about you and your health goals and how I can help you achieve that and help keep you accountable to get your gut well and achieve optimal health. So yes, please collaborate with your doctor, because like I said, it could be a sign of something more serious. And before we get going on tonight's topic, get your gut well, achieve optimal health, I have my notes are here, so you're going to see me looking. I normally ask you a fun question, but tonight I'm going to do it a little different. I'm going to tell you some fun gutsy facts. So here you go. Did you know that your gut holds about 1 trillion microbes, aka bacteria, and just in 1 drop of colon fluids holds over 1 billion of these? That's a lot. 1 single tiny drop. Also, if you battle with anxiety or depression or maybe mood swings, know that your gut holds 95% of your serotonin, which is the happy chemical in your brain. So it has a lot to do with your mood. We're going to talk more about that tonight, because it is Mental Health Awareness Month this month. Next, if you want to lose weight and you're having a hard time there, know that it's your gut that actually talks to your brain to tell you that you're full, not the other way around. That's with the gut-brain connection. Hello there. If you've come in a little later, please let me know. Say a hi, give me a 1 if you are here with me live. Welcome in. Also, if you're trying to stay healthy, stay away from colds and viruses and just the flus and the dang COVID, right? Know that your gut holds 70 to 80% of your immunity. So that's big too. So this is why I'm saying, get your gut well, achieve optimal health. So let's begin to talk about this. Why gut health matters. Well, gut health is like the nucleus of all of your health, as I just said. You know, there's 1 trillion microbes in your gut. That's just so many numbers there. Can't even think about it. And really your gut health impacts and is important to every area of our life. This is why I have such a passion for helping people get their gut well, because I really want them to be healthy. When they do that, they'll be healthy. So your gut is made up of these microbes. They are called good and bad bacteria. Literally, they are, okay? And so I'm gonna simplify this for you. And the good bacteria do lots of good things for you. They do lots and lots of good things. And the bad bacteria do bad things for you, make you feel terrible. And I'm going to talk about some of these symptoms that the bad bacteria causes here in just a moment. So when your gut bacteria gets out of ratio, all right, you want them about like this, or good bacteria even more up here. You want it overpopulating the bad guys. Because when it's not, there's a scientific term called dysbiosis. You don't have to remember that. Just remember good and bad bacteria. And when the bad bacteria are taking over, it causes a multitude of symptoms. Compromises your immune system and increases your risk for illnesses. What are those illnesses, Rachel, that you're talking about? Well, sometimes, every once in a while, people's gut is not well and they don't even have any symptoms. So that's pretty amazing. That's why I'm a big believer in preventative health care. Yep, preventative health care, that's the way to go. And that way, you'll be set up to achieve optimal health already. Okay, so one of the symptoms that happens when the bad bacteria are proliferating, because the bad bacteria, when they take over, they like to invite all their friends, and their friends are troublemakers, and they cause all this trouble, like bloating, constipation, diarrhea, that irritable bowel syndrome, even abdominal pain. During my journey of being a gut health nurse and a digestive disease nurse, I was experiencing my own symptoms of digestive. This is why I do this, because I've been there, done that. I helped lots of patients, and the doctor helped me. However, I only felt well some days, and I was spending a lot of money and eating certain foods and depriving myself of certain foods, and I wanted to stop all that and feel well every day, right? I wanted to just stop that. And so, with that being said, I had abdominal pain right here where your ribs go together. That's right where your stomach is, for about 7 or 8 years. On a scale of 1 to 10, with 10 being high, I lived most days at a 7 or 8. Pretty sucky, isn't it? Yeah, it affected every area of my life. Just had to push past it, but it drained me. All right, if I was having a good day, if it was down at like a 5. So you see how that just affects your whole life. I've been here, done that. And the other symptoms that the bad bacteria can cause are heartburn, acid reflux. It increases belching, especially after meals. Now, some of the illnesses that can happen because of that are inflammatory bowel disease. Now, I don't know if you guys have heard of that, but have you heard of the term ulcerative colitis or Crohn's? Okay, so I'll explain that. That is when your intestines from your mouth to your exit down there, your anus, is all inflamed. Yeah, think of like a red rash, and sometimes they get ulcers on them. Oh gosh, those patients have to take a lot, and getting your gut well can help put that into remission. And that's other things I can help clients with too, help putting those illnesses into remission. So, but did you know your gut health affects your heart too? So things like high blood pressure, all right? Your stroke, increases your risk for heart attack when your bad bacteria is up there, when you don't have a well gut. So cardiovascular disease is very significant too. People don't think about that. Also, autoimmune diseases are affected by your gut health. If your gut's not well, you are at higher risk for developing autoimmune diseases such as lupus, rheumatoid arthritis. That would also be multiple sclerosis, a little train of thought there. And then things like Hashimoto's thyroiditis. Yes, celiac disease. I did a show on gluten, and celiac is an autoimmune disease where you're allergic to gluten. It's very serious. Hello there. Thanks for coming on. I see somebody's on. If you would, say hello to me. I'd love to say who you are. Put a number 1 in there for live. And some of the other things, this is Mental Health Awareness Month, okay? Your gut, remember I said that 95% of your happy chemical or serotonin is actually made in your gut. There's a gut-brain axis right here. There's a big nerve that runs right here from your brain to your gut. Think of it as a major highway or a major interstate constantly communicating back and forth with each other. So if your bacteria is out of proportion, more bad than good, you can experience anxiety, depression, brain fog, even it's been linked to dementia, and also Alzheimer's. So those are not very fun things, including mood swings are not so fun. So I'm going to talk about this in a little bit later because I'm doing a little special on the mental health awareness. So stay tuned there. Of course, obesity and diabetes and also skin irritations are affected by your gut health. You've been to the dermatologist and they're prescribing hydrocortisone creams or maybe an antibiotic cream, and that rash or that psoriasis or eczema is still not getting better. It could have to do with your gut. So if you're having those issues, highly recommend that you reach out to me and we can talk for a free discovery call and see if getting your gut well may be the option to go, maybe your answer. Now, one thing I want to put a big hoo-hoo on for is just overall wellness when your gut is well. So common cold, flus, viruses, asthma, allergies, things like that. So I've been on this journey since about 2019 when I decided to change from taking all those expensive medicines and seeing the doctor and still feeling crappy most days of the week. I wanted to find a lifestyle where I could enjoy food again, slim my tummy down and not feel like I'm 4 or 5 months pregnant every time I eat, and even after a glass of water. That was me, bloating up like I feel 4 or 5 months pregnant from a glass of water. I could eat a sandwich and an apple and feel like I'd had a Thanksgiving dinner back then, but no more. My stomach is well, my gut is well. So what that means too is I have less colds. In fact, I haven't had a cold, knock on wood, in like 3 or 4 years, because your gut health holds that 95% of immunity. I'm one of the lucky ones that did not get COVID. I'm a minority out there. Maybe you're a minority. Have you had COVID? Let me know if you're a minority or not. My husband had it 3 times. I didn't catch it. I warned that a lot on my gut health. So those are just some of them. And the list, this list that I gave you here was just a snip. It's not all inclusive. I've been studying this for a while and I read lots of books and I research, and this is what I give you. So the list is actually extensive, and if you want to know more, please reach out to me. I'm happy to talk with you. I can have a free discovery call or just answer questions in the chat. If you have questions, put them in the chat, please. I hope this is making sense. If you're watching and this is making sense, then say yes in the comments for me. That would be great. Okay, so there is one thing in common that all of these symptoms have and illnesses have. A well gut can bring relief, very good, reduce, and in some cases, heal all of them. Autoimmune diseases have been put into remission. They won't ever go away. Diabetes won't ever go away, but they surely can be put into remission. And isn't that fantastic if you didn't have to take this medicine, expensive medicine, and get into the donut hole with Medicare and, just tired of taking medicines and feeling crappy most days? Get your gut well and you'll have a joyous, happy life. So very good. Restore your gut, and you'll have happiness. So I said I was going to focus a little bit on mental health awareness. So I wanted to do a little tidbit on that. Did you know that the foods you eat may treat depression better than the medications that are given to you? It's easy to take medications, but if you're not one of those who want to do that, focus on getting your gut well, because the gut is called the second brain. Remember that nerve, it's your highway right here. Your gut impacts your anxiety, your depression, your mood swings, and in reverse, anxiety and depression, mood swings impact the gut. Back and forth, back and forth. The good bacteria, remember the cheerleaders, the good bacteria, makes that serotonin in your gut, the happy chemical, 95%. And this serotonin actually does a lot more things than just making you happy. It helps with your immunity, and the gut bacteria just helps with so much in your life. And again, my list was not all-inclusive, but it's a lot. So reach out to me if you have more questions. The more good bacteria you have, you can get it up here, and your bad bacteria is down here. You're still going to have some bad bacteria. That's just how it goes. But you want it, good bacteria here, bad bacteria down here. The more serotonin you have, that good bacteria means less anxiety, less depression. Also, did you know that probiotics are a good, all-natural antidepressant? Doctors don't advertise that, do they? Just saying. So, happy gut, better mood. Woo-hoo! Who wants a better mood? Okay, now I want to give you guys some things, how all this dysbiosis happens and how the gut bacteria gets out of balance. Well, the number one, well, they're all equal, but I'm going to put it right up there at the top. Processed foods, Western diet, processed food, boxed foods, canned foods, frozen foods, ingredients on the list that you can't pronounce, all right? High sugar foods. I don't just mean cupcakes and candy bars and, donuts. I mean bread, pasta, rice as well. Those types of things in there. Flour, anything with flour, that's a lot of carbohydrates. Carbohydrates are sugar. Your bad bacteria love sugar. So the more sugar you're feeding it, that bad bacteria is having a party. They crave more and more and more. Those are actually your cravings. The bad bacteria going, gimme, 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 gimme. That's what it's saying. So the other one is gluten foods. That's highly inflammatory to your gut. I did a Gutzy show on that. If you want to learn more about that, it's on my playlist on this page here, Florida Guts coaching page, on the business page. And it's very informative, have a lot of viewers and lots of comments on the gluten one. I mean, it's just amazing. Another one is antibiotic use. You're like, what, Rachel? Why is antibiotic use? Well, the doctor prescribes those to help you fight off maybe a respiratory infection, a skin infection, or maybe you have, a throat infection, or maybe you have a gut infection. Like I often used to get SIBO, that small intestinal bacterial overgrowth. Anybody out there else get SIBO, small intestinal bacterial overgrowth? That was me during my time before, not anymore. But what that is, that's an increased, that's the bad bacteria getting more, higher and higher up here. And they prescribe antibiotics for that. What happens, it may make you feel, this is mine, that's why I kept going around in circles and circles. It makes you feel good for a little while, but what it actually does is kill off the good bacteria too. So it's killing off the bad bacteria, it's killing off the good bacteria, and you're not left with a whole lot left. So it takes about a year, research says, for you to eat well, okay, eat in a way that is healthy for your gut. I have that in the program, in the coaching program, and rebuild your good bacteria from one dose, like a week or 10 days or however long you're on it of antibiotics. Isn't that just crazy? Just crazy. Yes, high chronic, high stress high chronic stress or anxiety. Remember, it's the gut-brain connection. They both impact each other. We live in this world of constant stress and anxiety because it's just big now, especially since COVID. I don't know if it's just more talked about, but it's really up there. And all this negative news, we have social media can actually be a little stressful sometimes. We have the negative news, like I said, and just bombarding us. So we don't live in a world where saber-toothed tigers are chasing us, but because we have this chronic low level of stress, our body reacts the same, and it can really mess up the gut bacteria in your gut. Now, something else that's been researched and linked is poor dental hygiene. Are you brushing your teeth twice a day? Flossing? Are you? Let me know. Tell me in the comments. So poor dental hygiene. Think about what your breath smells like when you wake up. Not so much like a bed of roses, huh? Nope. That's the bacteria. For some reason, it settles in our mouth overnight. Who knows why? But it has been linked to the dysbiosis of your gut bacteria. Of course, we have environmental toxins, we have pesticides, we have, aerosols, we have lotions that we put on us that we can't even describe the words that are in them, hairsprays, makeup that we put on. We have juices and foods that we eat that we cannot pronounce the names in them, or color, dyes, the color dyes in foods and things like that. Those are all environmental toxin types, and they can disrupt your gut microbiome. Big one too that I've talked about a lot before, artificial sweeteners. Secret, those are more of the saccharin, the aspartame, and the sucralose. That's kind of hard to say. I'm not talking about the monk fruit or the stevia or so much the erythritol. I did a Gutzy show on those as well. If you're curious about that, go back and check out the Gutzy show about artificial sweeteners. It's a very informative, it'll be an eye-opener. Okay, so 2 more things. Alcohol. Who doesn't enjoy a drink? I do. I like wine. I like to have a glass of wine and alcohol. It has been studied that alcohol is very inflammatory to the gut. It's inflammatory to the liver as well, we know, because a lot of things process through the liver, but it's also inflammatory to the gut with 2 or more drinks a day. And the study doesn't differentiate between men or women, because the standard is, women get to have 1 drink and men get to have 2, but the study didn't differentiate with that. It's 2 drinks. So again, think of your stomach being like a big red rash, or maybe even scabby if there's ulcers in there. It's a good idea to, if you can, take breaks from alcohol throughout the year. If you enjoy your glass of wine or your hard seltzer or your beer, that's okay. Moderation is key, but try to schedule in breaks throughout the year, 2 to 3 weeks or a month off. Your gut will thank you. All right, last one here. It's going to be a surprise. Staying too clean. Staying too clean, because we have the antiseptic, gel that we use, hand sanitizer. We have Clorox wipes to wipe off the counters. We have antibacterial soap that we wash our hands with. And those are all good and well for killing off the germs and the viruses and the bad bacteria. But guess what else they do? They kill off the good bacteria. So again, it's that fight, just like with the antibiotic use. Pretty amazing. Now, I don't want to leave you all just hanging dry, hearing all this bad news. I would like to give you some 5 tips to help you get your gut well and achieve optimal health. You can start these today, right after the show. They are free to you. You don't have to rely on anybody else. You can start them. They're just 5. I have a lot more in my tool bag, so you can apply all these. You may be even doing some of those. Or if you think you might need a little more, please get in touch with me. And again, that free discovery call, we can talk about it. So number 1, chew your food to mush, M-U-S-H. If you know me well, I say that all the time. That's 20 to 30 times, whatever you're eating. If you're eating a piece of steak, that's probably going to take 30 or 40 times if it's well done and rubbery, right? Or if you're eating something like scrambled eggs that may only take 20 times, but you want it to be mush consistency. That's like that. Think of cottage cheese or yogurt, oatmeal type of consistency, 20 to 30 times. Drink a glass of water in the morning upon rising, meaning when you get up in the morning, you go out to the kitchen, don't have your coffee first, don't have your tea or your, whatever you drink in the morning, drink a glass. 12 to 16 ounces is what I tell my clients. 12 to 16 ounces, room temperature, or if you can, slightly warm. Your gut will thank you for that. It's just easier on the digestive tract, and it helps to get things flowing. Want a little bonus? If you add some lemon juice in there first thing in the morning, it's going to help to detox your liver. So if you did have a drink the night before, it helps to do that. And then also that acid in the lemon juice gets the acid going in your stomach so it can help you digest food. We need this acid in our stomach actually to help us digest food. So 12 to 16 ounces before you have your other morning drink. It's recommended. That will help you. Incorporate colorful vegetables into your diet. As many colors as you can get in a week. 5, look at my hand, it's so shiny. 5 servings a day. I know that's really hard, but your gut will thank you. And what that looks like is a half a cup cooked or 1 cup raw. So colorful vegetables. Green leafies, and of course, one of my favorites is ginger. The next one, number 4, is to include daily mindful movement into your day. I know it's exercise, but it doesn't have to be a lot. That's why I like to call it movement. What movement does is it helps to move the digestive juices and the colon and the gut around. And to help keep your gut well, you certainly don't want to be constipated, because if you're constipated, your gut's not well. And it helps to get that all flowing, again, the juices, so you can digest food better, have less bloating right after a meal. So if you can do this maybe for 5 or 10 minutes right after you eat, walking leisurely or some light activity leisurely right after your meal, that'll help stop the bloat, decrease it at least, and then just help you metabolize it faster. So it's really a good thing there. You could do things like, of course, walking, you could do swimming, you could do strength training, you could do gardening. Now, if you're somebody who has mobility problems, it's okay. There's no excuse. You can move your upper body. I have taught chair yoga before. There's stretches in your chair, this little twisting motion helps your gut. You can move your arms around. That's all movement. It helps to keep the blood going. You could do jumping jacks in your chair with your arms. That's going to help. And even in your chair, you can kind of lift your legs up like you're walking in place. So, yeah, even if you're not as mobile as everyone else, that's okay. There's no excuse. Get a little movement in and your gut will thank you. All right, the last one. Did you know that NSAIDs and aspirin, now NSAIDs are ibuprofen. And I'm just going to say the generic name, but yeah, those are ibuprofen. There's some brand names out there, but those are highly inflammatory. The aspirins are highly inflammatory to the gut. So if you're trying to get your gut well, that's your goal. It's very important to avoid those. If you still need something for pain or aches or sore muscles, Tylenol. Read the directions on those, and of course, remember to check with your doctor too. Turmeric is a great anti-inflammatory. You can make turmeric tea. You can add turmeric spice to your foods. You can take turmeric capsules. There's lots of choices out there to help you fight aches and pains and inflammation that you may be feeling besides taking the NSAID or ibuprofen or the aspirin. Magnesium, certain types of magnesium. There's lots of magnesium types out there, but there are some that help specifically with muscle aches, fatigue. Okay, so check that out. You can Google that. Another simple thing is to take a hot bath. Let all your muscles relax, and it may take your headache away. often, if you're not hydrated, not drinking all your water, you're going to get a headache. A headache is one of your first signs of dehydration. Drink water, and it may cure it. Meditate. Just breathe. There's some little tricks you can do that. Breathe in for 4. Hold for 4. Exhale for 4. And repeat for 1 minute. Yeah, that's a great de-stressor. You take your headache away and just take away your aches and pains. The other one, if you can, take a 20-minute cat nap. And that's maybe all you need there. So those are my 5 tips. These are things that I do incorporate into the coaching program too. I have a lot more in my tool bag, but you can try those. You don't need to depend on anybody for those. And so just want to say thank you and for being here. If you're interested in the coaching program to get your gut well, achieve optimal health to total rejuvenation, I offer one-on-one personalized holistic, which means whole body sessions, 1 hour just for you. They're simple, sustainable methods. Their healthy habits become just who you are. And they're little curated bits of information, so nothing too overwhelming. We'll take action steps together so that you have inevitable success. So I did mention I offer free discovery calls. If you feel like you need to get your gut well, or you may know somebody who needs to get their gut well, wants to achieve optimal health, please share this video. That would be very helpful for me with the algorithm. And then also comment in the, put hello or something in the comments. It always helps with the algorithm, and I appreciate you so much. So, well, that's all I have for now, and I thank you so much for your time. Again, if you were here with me live, put that number 1. Watching the replay, put a number 2 and say hello. Alrighty, well, this is Coach Rachel signing off, and I hope you have a fabulous rest of your day. Till next month.